Why do you think there is that fear of the dentist? What do you think it stems from? Obviously, it's not nice having the procedures, but people put off going, don't they, a lot? And it's a bit of a thing. Would you agree with that? Or?
I would agree, and it's a problem that the profession has struggled to address. Dentists are unpopular politically, as well as amongst the public, possibly because going to the dentist is classically painful.
Yeah.
You're usually going when there's a problem. There aren't many good outcomes from going to your local dentist. Now, we operate slightly differently here, as you know, in that we're an aesthetic and cosmetic clinic. So people are usually seeing us when they are near healthy or at health state where they just want to make things look better.
Yeah.
But if going to the dentist is associated with pain, relatively high cost, I can see why people would associate it with just bad things. And unfortunately, healthcare practitioners sometimes struggle with the communication side.
Right.
So that makes it worse as well.
What do you mean by that then, like, as in?
I mean, in order to take someone who's relatively nervous about a procedure, let's say taking a wisdom tooth out, it takes a certain personality to understand who's in front of you and take them down from a nervous state into a more comfortable state where they can actually cope with the treatment in a way that doesn't traumatize them.
Yeah.
And that's quite a complex personality kind of negotiation. And it's not something you're necessarily taught. It's not a medical or dental skill. It's taught through life experience or working with lots of different people from different backgrounds. And that's the thing that might give dentists a bad reputation when it comes to communication. And people always think about the grumpy dentist.
Yeah.
Everyone knows one. Why is that?
Yeah. Is there like an element of sort of just getting on with things with guys and their teeth, do you reckon? Or is that an outdated stereotype?
Men in particular?
Yeah.
Yes, there is. There was a study done between male and females. What's the percentage of people that present to the dentist and under what circumstances? And they found pretty much irrefutably that men presented to dentists when they were in much more severe pain than a female. Reasons for it? It's probably pretty complex on the psychology, but as a result, if you present to your healthcare practitioner later, the odds are you're going to have more comprehensive, more need for treatment, and that might lend itself to losing teeth. Losing teeth just comes from heavy decay, breakdown, and not addressing it early.
Yeah.
There comes a point where a tooth has lost so much structure that you can't save it. And there are a couple of measurements we use, and there's a method to it. And when that time comes, the best advice is really to remove it and look at replacement. And if those teeth are not replaced, there are other issues like teeth drifting, your bite gets shifted to another side of your mouth, and this happens without you knowing about it.
The longevity of our teeth, how long they're meant to last, really, because a colleague of mine was saying that, when I was talking about my teeth travails, that they're not really meant to last that long, as in as long as we're meant to live. So 40 years or so, is that a thing, would you say? Like, if our teeth are sort of not really designed to last as long as we as humans now live for? Yeah,
that's I think that's fair to say. 40, 50 years is what our ancestors would live to at maximum.
Yeah.
And when there was no industrialization, the diet was very different. And if we look at the skulls and the teeth that are left behind, relatively unworn, in pretty good condition. So we're now in a state where we're in modern society, eating and drinking very different things, putting our teeth under a different sort of stress, and we're living longer.
Yeah.
So all of this lends itself to more dental requirement. Overall, I think it's not a bad thing. We're living longer. That's a good thing. It has some downsides, but we just have to look after ourselves a bit better.
Yeah.
So it starts with education, which I guess why we're here.
The whole veneers thing and the turkey teeth chat has been out there a lot recently.
Yeah.
There's been a lot of documentaries, a lot of social media chat about it, and I've seen so many things about it recently. Honestly, there's so many. It seems to be the number one trending thing in sort of like teeth chat, I guess, if you like, at the moment. There seems to be like a really sort of popular thing to go and do right now. Are veneers like for everyone, or what sort of prompts someone to get veneers, would you say? And is turkey teeth related to veneers as well? Is that?
Yeah, I mean, you've raised a good bunch of questions. Let's start with the term veneer. It's a term that's slightly misunderstood. It's an umbrella term for a thin layer of ceramic or other material that sits on the outside surface of the teeth to make it look a different shape, color, or appearance. So that can really fix a whole host of things to do with discoloration, gaps, malaligned teeth or crooked teeth, teeth that haven't come through the quite right shape. And it can really be quite a versatile way to make things look better for many people. What prompts people to have veneers is wanting to look better usually.
Yeah.
A veneer can also improve the health in some way. This is something that's also not commonly understood. It can influence the way your bite sits. It can reduce your risk to decay by incorporating into any fillings on a particular tooth. So all of those things make veneers a very versatile and safe thing to do, in my point of view. And that's according to the protocols we use here. What happens in Turkey, I don't mean to cast all the clinicians there with one brush.
Completely, yeah.
But what we're seeing on
it does seem to be a term. I mean,
it is a term.
Documentaries saying, calling it turkey teeth, and that's obviously, like you say, I agree with you. You don't want to cast aspersions on the whole nation of it.
Because there are great clinicians in every nation. However, the hashtag and the trend turkey teeth associates with having very aggressive dental work done to the teeth to make them look better, but in a way that I wouldn't call veneers. They are crowns. The difference between a veneer and a crown is a crown goes all the way around the tooth. A veneer just sits on the outside. So a crown takes much more destruction of the tooth and poses much more risk long term. I almost never advise someone to have a crown at the first instance. A crown is something you have later in life, probably at advanced age. A veneer is much lower risk.
Is there a way to prod people to go to the dentist if they're really apprehensive? How would you sort of sell that to someone?
That's a tough one.
Yeah.
Really hard.
Not that you should have to. I mean, everyone should do this naturally, but...
Well, I think that's almost coming to the answer. Usually, psychologically, you tell someone to do something, they'll usually not do it. They'll do the other thing. They'll balk, go the other way.
Yeah.
I'd like to encourage it in a secondary way, a non-specific, indirect way, through education.
Yeah.
Educate to the point where someone understands as much as they can from their own home, and if they still need advice, that might encourage them to think, well, I might need a third party here to give an opinion.
Yeah.
I'm of the mentality that people can do things in their lifestyle as they wish. If it makes you happy to do the things that we know are damaging to our health, dentally or medically, and it makes you happy, please go ahead. Just go ahead with the knowledge of what might happen.
Yeah.
And contact a healthcare professional if you do. So in that way, I'm pro-choice for anything that people want to do to themselves. And I think that should help people understand that we're not here to tell people off.
Yeah.
As the image of dentists could be. We're here to try and help. You don't have to seek our help, but we're here if you need us.
Best toothpaste, best toothbrush, best mouthwash. Do you have any recommendations or any other best products or things out there that do the job? Because I hear so many different kind of brands and and kind of products that are supposed to be better for us, like a mouthwash and all that kind of thing, and whether you should use mouthwash after brushing or is there a best sort of practice for all that and best sort of product use for any of these?
There's best practice for all of the above. Where do we start?
Sorry, I'm throwing a load at you there. So
let's go with a toothbrush. That's the first thing you pick up when you go for your morning or evening routine, and that's if you're brushing twice a day.
Yeah.
Toothbrushes, you've got manual and electric.
Is twice a day mandatory or not, would you say? Is it?
Twice a day for 2 minutes is recommended.
Yeah.
The evidence tells us that if you're not genetically susceptible, you can maintain health by once every other day.
Yeah.
However,
right.
The profession advises everyone to do twice, 2 times a day for 2 minutes because usually you don't get a perfect brush in terms of that each cycle. So you do a little bit more to maintain health. So I'd recommend that. I recommend the latter. So your toothbrush, manual or electric, both can achieve the same standard of clean, depending on the technique. With a manual, it's much harder to achieve that. So we usually recommend electric. the evidence supports a rotating design, small circular head that is made by two major brands, Oral-B and Braun. Both are very good. You don't have to go for the one with all the bells and the whistles. Just choose the one that suits you.
Yeah.
There is one in between, which is a vibrating sort of design, Philips Sonicare, and the ones which have a battery. Those are okay, but the evidence is not as strong as to their efficacy compared to the rotating design.
Yeah.
For the manual ones, all I would say, look for a soft bristled head, look for a flexible neck. In the packet, try and flex the neck. If it doesn't flex, it's no good.
Right.
These bamboo and wooden and acrylic ones, which are so-called eco-friendly toothbrushes, are great for the environment, but they're not that great for us.
Right, that's what I've got actually at the moment.
Yeah. They don't flex.
I do have an electric as well, actually. Yeah. So.
Yeah. Just check that they flex. That's the main thing. Soft bristles always. The other thing I recommend to people is using a 3-finger hold technique. So if this was a toothbrush, you'd hold it with 3 fingers on the end.
Okay.
Rather than with a fist.
Right. Yeah.
The reason being is we're doing a bit of over-brushing these days. We're seeing a lot of recession on people's teeth, and part of it is due to overzealous, aggressive brushing.
Right. Oh, gosh. Okay. Yeah.
Toothpaste.
Yeah.
Let's say you don't have sensitive teeth. Sensitive teeth is a separate set of toothpaste. Any toothpaste which has a fluoride content in it is going to be good for you. That is the only element in the toothpaste that imparts benefit. There is nothing else in it.
Yeah.
Unless it's sensitive toothpaste. Colgate's, McLean's, Aquafresh, Oral-B, all have got very nice toothpaste that you can use. I'd recommend any of them. The charcoal ones, the smoker's toothpaste, the whitening toothpaste, I'd stay away from.
Oh God, I use those as well.
Yep.
The Arm & Hammer one.
Yeah, I think when you go home, you're going to have to just sling all of that to the
Really?
side.
So just go for a Colgate or an Aquafresh, really?
The Colgate Total and Aquafresh regular.
Really?
Yeah. The charcoal ones and the whitening toothpaste have a higher level of abrasive in them. And
that's what I use. It's literally what I use every day.
yeah, and think of it as just skimming off a very thin layer of the top of the enamel every time you brush.
Oh, right.
Which isn't sustainable long term in our view. And there are better ways to whiten your teeth.
Yeah.
If you want to whiten your teeth, just let me know.
Yeah, okay. I'm sure I will do, yeah.
There's a safer way. And then if you have sensitive teeth, there are sensitive toothpaste made by Colgate and Sensodyne. Very effective, also containing fluoride. So that's what I'd suggest. You don't have to go to a niche brand. The major brands are actually the leaders, and genuinely they are. They don't support us financially to say that. They actually do make good formulations. They've stood the test of time over 20, 30 years of research. The new ones have not.
Yeah, yeah.
Mouthwash.
Yeah.
No need to use mouthwash. We can all save ourselves plenty of pounds by not using it.
Okay.
The only time it is helpful is certain gum conditions. You may need to use a particular mouthwash on the advice of your dentist. That doesn't apply to you. It doesn't apply to the majority of the population. Mouthwash is good for fresh breath, and it can be helpful in the middle of the day when you're perhaps at lunchtime to rinse out anything that's in your mouth. But other than that, the fluoride level in mouthwash is relatively low.
Maybe I've just thrown this concept in there about tooth dysmorphia. Body dysmorphia is obviously a thing, with how we sort of perceive our bodies. And I don't know whether there's a concept of tooth dysmorphia, whether we look at our teeth and think, oh my God, do we need work when we actually don't need it? Is that a concept or an idea or a thing that you think is legitimate or not?
It's a concept, it's an idea, it's a diagnosis.
Right.
And it's one made by the medical professions. So it becomes a difficult thing as dentists to point at someone. So we refrain to do that.
Yeah.
However, we're aware of the condition and we're aware of the signs that might indicate it. How much research have you done? What sort of level of self-care and maturity are you approaching your health with? And there's a barrage of kind of tests we do internally to understand, is it in your best interest to have X treatment, for example, veneers?
Yeah.
Do you understand the long-term implications? Do you understand the alternative options? That sort of thing. And if the answer is yes, then we're quite happy to proceed. And I'd say in 90% plus cases we do. But there are times when we would recommend to someone to go down another road, which they may not wish to. And that can be a tough conversation. But at that point, we're looking out for their health, and it becomes a more paternalistic conversation.